So now that we've established the benefit and the use case around digital pathology, let's talk about building it out. And I always like to start with this question of who's the driver in the health system? What's the role that is driving this in the health system?
So ultimately, I would say your ideal scenario would be to have a multidisciplinary team. You have to have the clinicians involved, of course, the physicians that are actually going to be doing the pathology reading, but you have to have the IT support and the operational support as well. You truly need that multidisciplinary team, just as we did when we digitized the electronic health record or digitized PACS systems, or I guess moved to PACS systems. But having those multidisciplinary teams is absolutely crucial. And it will vary who is really leading the charge or helping a health system to move in that direction, being the champion for that, depending on the health system, because there are so many different reasons to want to move in that direction. In some cases, it might be a head of innovation that's really pushing things forward. In other cases, it may be the pathologists themselves wanting to move to that different workflow, that better workflow, and be able to access collaboration more effectively. In other cases, it may be other folks on the team that are really sort of leading that push to move in this direction.
Yeah, and clearly this is a change in workflow as well. So like most digital transformations, it affects a variety of stakeholders, and certainly it's helpful to have all those stakeholder groups, to include the technologists that are doing the work, the slide prep work and the slide creation work, and the lab managers. So it really gets done with a group of people. I think, as been stated, clearly these projects tend to start in the clinical team. They get envisioned as a change in the way clinical services are being delivered. But we do like to encourage that the IT group get involved early, given, as we just mentioned, the size of the data is large, the retention requirements are long.